Welcome to the deep dive. You probably already know AI is completely shaking up health tech right now.
Yeah, but keeping up with the sheer volume of new literature is, frankly, it's a full-time job.
It really is. We've got you covered, though. Today we are digging into a 2026 narrative review from Molecular Brain. It's titled Artificial Intelligence-Based Biomarkers for the Diagnosis and Treatment of Neurological Conditions.
Right. And our mission for this deep dive is to explore how AI is shifting how we detect, predict, and ultimately treat brain diseases. We are looking at a pretty profound transition in medicine here.
Moving from that old reactive, wait-and-see approach.
Exactly, moving straight toward hyper-personalized precision neurology.
Okay, let's unpack this. Because historically, discovering biomarkers has been this massive bottleneck. The traditional process is notoriously slow,
Oh, that's LA.
and it tends to be so reductionist, looking at just one tiny piece of the puzzle at a time. It simply cannot handle the vast amounts of multimodal data our bodies constantly produce.
Right, and what's fascinating here is that AI entirely bypasses those limitations. It
Mm.
actually thrives on those vast data sets.
It feeds on them.
It does. Instead of looking at a single protein, AI processes complex brain imaging alongside multiomics data,
Genetics, proteins, metabolism.
all at once. By synthesizing that absolute fire hose of information, it spots hidden patterns human eyes just aren't equipped to see.
Which allows doctors to detect diseases years before conventional methods ever could.
Precisely.
Here's where it gets really interesting, because AI hype is everywhere right now, but are the numbers in this paper actually moving the needle for things like, say, Alzheimer's?
They absolutely are. For instance, AI models can predict if a patient with mild cognitive impairment will convert to Alzheimer's disease with 85 to 90% accuracy.
Wow. 85 to 90. And what about acute conditions, brain bleeds, things like that?
Just as impressive, they're identifying intracranial aneurysms and catching over 90% of true cases.
That is a huge leap in sensitivity.
It really is. And if we connect this to the bigger picture, those statistics translate to profound real-world applications. AI improves stroke outcome predictions far beyond our standard scoring systems. Or look at brain tumors, specifically gliomas. AI is extracting what researchers are calling radiogenomic biomarkers.
Right, so instead of waiting for an invasive biopsy, the AI essentially reads the texture of the tumor directly from an MRI.
And tells you it's genetic mutation right then and there.
That's wild.
Huh.
It outperforms traditional diagnostic strategies and spares patients from unnecessary surgery.
Exactly.
So what does this all mean? The numbers are phenomenal, but let's talk about the catch.
There is always a catch.
Right. If it's 90% accurate, shouldn't we just trust the math, even if we don't fully understand how the model got there?
It's tempting, but this raises an important question regarding real-world constraints. The researchers are very transparent about the lack of external validation right now.
So an AI trained on imaging equipment in one hospital might fail when used on different machines in another.
Yeah. Exactly, the classic generalization problem. Plus, there's a critical gap here. Underrepresented populations are often left out of the training data.
Which could totally skew care.
It could. And then there's the major challenge of interpretability, the notorious AI black box.
Right. The model might give a highly accurate diagnosis, but it can't always explain the why.
It's like having a brilliant doctor who always gets the diagnosis right, but when you ask them how they know, they just shrug.
In medicine, you can't just shrug. You need clinical justification to authorize serious treatments.
You certainly can't blindly follow an algorithm into brain surgery.
So the big takeaway from this review is that AI-driven biomarker discovery is a profound leap toward precision neurology.
But its true impact hinges on robust, cross-hospital clinical validation.
And equitable data representation. This isn't just an abstract paper. This is the immediate future of your own healthcare.
Precisely. It requires a thoughtful integration of technical innovation and rigorous clinical practice to ensure these models are actually safe and effective on the front lines.
Which leaves you with a final thought to mull over today. If an AI model could predict your likelihood of developing a severe neurological condition years in advance with 90% accuracy, but couldn't easily explain how it reached that conclusion, would you still want to know?